Hello, I'm Kaylin, and this is my head-to-toe assessment for Dr. O's health assessment course of fall of 2024. I'm going to start by scanning the room. And the floor. Upper floor. And the ceiling. Okie dokie. So I have washed my hands, I have introduced myself and confirmed 2 patient identifiers. Before we begin, I'm going to be assessing the skin. I'm going to be checking the skin of the head, face, neck, anterior, posterior chest, upper, lower extremities, and abdomen. I'm going to be checking for color, temperature, texture, turgor, edema, moisture, bruising, scars, lesions, and nevi. So I'm going to start by looking at the head. I'm looking at the shape, size, symmetry of it. It's normocephalic and in midline position. I'm going to palpate the scalp. The hair distribution is even. There are no depressions, masses, tenderness, or infestations. The color is brown and the texture is coarse. I'm now moving on to the head, and I'm going to palpate the temporal arteries for tenderness, which there are none. I am now going to assess the lymph nodes, so hopefully you can see. In front of the ear for preauricular, behind the ear for postauricular, back here for occipital, tonsillar, submandibular, submental, almost at the tip of the chin, anterior cervical, posterior cervical, and supraclavicular. No tenderness or nodules noted. I am now going to palpate the TMJ, so open, close, and clench. So there was no crepitus, tenderness, or subluxation with the jaw. I was also assessing for cranial nerve number 5, which is trigeminal, when I had the patient clench as I palpated over the masseter muscle, which is intact, but I'm also going to assess it by doing another test. So I'm going to have you close your eyes and tell me where I'm touching you.
Forehead, cheeks, chin, nose.
Good job, you can open. I'm now going to assess cranial nerve number 7 by looking at the symmetry of facial movements. So I'm going to have you smile, frown, puff out your cheeks, pucker your lips, and raise your eyebrows. Good job. While I'm here, I'm going to go ahead and palpate the frontal and maxillary sinuses. No tenderness. And now I'm going to move on to the ears. And so when I'm looking at them, I'm looking at shape, position, symmetry, and I'm going to start palpating the pinna and the tragus for masses, which there are none. I'm now going to take my otoscope and look in each ear. I'm checking the auditory canal, which is clear, and the tympanic membrane is pearly gray, and the other ear, same thing, patent and pearly gray tympanic membrane. I'm now going to assess cranial nerve number 8, which is vestibulocochlear, by doing a series of 3 tests. It is the whisper test, Weather's test, and Renee's. So cover your left ear and repeat after me.
99.
And cover your other ear and repeat after me.
99.
Good job. I'm now going to have you tell me if you hear the vibrations in the right ear, left ear, or middle.
Middle.
Okay. And now, Renee's test, I'm going to do, just say now whenever you hear the vibration stop.
Now. Now.
Okay.
Now.
All right. So you took longer to stop hearing the vibrations outside of the auditory canal, so that means that bone conduction is not as great as air conduction. Air conduction is better than bone conduction. Okay, so now we're going to move on to the eyes. I am looking at the lashes, brows, and palpebral fissures. I'm going to, okay. I was checking the sclera and conjunctiva. There's no discoloration, no lesions, or discharge. And now we're going to assess cranial nerve number 2, which is the optic nerve, by doing a visual acuity test. So there is a Snellen eye chart right behind the camera. If you could cover your right eye and read the lowest line that you can.
PEZOLCFTD.
Okay, and the other side.
PEZOLCFTD.
Good job. And I'm also going to assess this cranial nerve by doing a peripheral vision test. So I'm going to have when you could see my hand,
Yep.
we'll look at my nose. Okay, now, how many fingers am I holding up?
2.
Alright, so how many you can see my hand?
Yep.
And how many fingers I'm holding up? Good job. So now I'm gonna test, the oculomotor nerve, which is cranial nerve number 3, to make sure that we're testing for pupillary reaction, direct and consensual. So look at my nose. Good job. And the pupils constrict and are curled. I'm also going to test the cranial nerve number 3, 4, and 6. It's optic, trochlear, and abducens by having the patient testing the conjugate gaze with EOM. So follow my finger with just your eyes. Good. No nystagmus or abnormal findings are noted. I'm going to go ahead and move on to the nose, which is straight in midline. I'm going to have you close your eyes and block off one nostril and take a big sniff. Now the other one, sniff. Good job. So the nasal passageway is clear, and can you tell me what you smelled?
Alcohol.
All right, and that is testing for olfactory nerve, which is cranial nerve number 1, which is intact. We're now going to move on to the lips, or the mouth. So we're going to be assessing the lips, teeth, gums, buccal mucosa, tongue, under the tongue, salivary duct, palate, pharynx, and tonsils. So if you could open rear wide, say ah. Okay. And I know the cranial nerves number 9 and 10 are intact, which is the glossopharyngeal and the vagus, because the soft palate and uvula rise with phonation symmetrically. Now I'm going to have you stick your tongue out and go up, down, left, and right. So the tongue is midline and that's enough. Tongue is midline and without fasciculations. So that's testing for cranial nerve number 12, which is hypoglossal. All right. Moving on to the neck, I'm going to check the trachea to make sure that it's midline, which it is. I'm going to palpate the thyroid, so swallow, kind of push the other side and swallow. Good, no irregular shapes, nodules, or tenderness. And now I'm going to palpate your carotid artery. +2, +2. I'm going to auscultate the carotid artery with my bell. Great. So now I'm going to have you turn around. So when I'm looking at the posterior chest, again, I'm keeping skin in mind, like the color is good, no pallor, it's moisture, it's warm. It is midline, it's straight, symmetrical, and I'm also checking for signs of respiratory distress. So that is going to be tachypnea, cyanosis, use of accessory muscles, tripoding, nasal flaring, and retractions, which there are none. I'm going to start by percussing the lung fields. Okay, resonance was heard throughout. I am now going to make sure that everything rises and falls symmetrically. So breathe in, breathe out. And now I'm going to do tactile affirmative. So say 99 when you feel my hands.
39. 99.
Good. I'm now going to auscultate the lung sound with my diaphragm. And just breathe regularly. Good. Clear the lung sounds throughout. While I have my stethoscope on, I'm going to assess for egophony. So when you feel my stethoscope, say the letter E. All right, and now say 99 for bronchophony. And now whisper pectriloquy, whisper 99. I'm gonna, while I have him here, check for CB, any tenderness, any tenderness,
No.
any tenderness.
No.
Alrighty, so now you can turn around. I'm now going to listen to the lung sound anteriorly, and again, keeping skin in mind and checking for symmetry, no deformities, masses, things like that. So just breathe regularly. Great job. I'm now going to palpate to make sure that the chest rises and falls symmetrically. Good. Good tactile primitus. 99.
99.
Good job. And now I'm going to listen to the heart cells with heart sounds with my diaphragm. So I'm listening to the aortic valve, which is on the right sternal border of the second intercostal space. Pulmonic, which is on the left sternal border, second intercostal space. Erb's point, which is on the left sternal border, third intercostal space. Tricuspid, which is on the left sternal border, fourth intercostal space. And the mitral, which is left mid-clavicular line, fifth intercostal space. And now I'm going to listen with my bill. Great. And now I'm going to palpate the PMI, and I'm going to listen for a solid minute. Wow, a whole minute's already passed by. So the rate was 60, and it was regular. S1 and S2 were heard. So now, Zach, I'm going to have you lean back. I'm going to start off with the head of the bed at a 30 to 45 degree angle. Let's see. So that way, as I'm inspecting, I'm looking for any heaves or lifts. I'm also looking for JVD, which there is none noted. And now I'm going to palpate over the auscultation sites, and I'm checking for thrills. And that's good. And now I'm going to lean you completely flat. Okay. And I'm going to auscultate the heart sounds again with my diaphragm. Aortic, pulmonic, Erb's, tricuspid, mitral, and with my bell, aortic, pulmonic, Erb's, tricuspid, and mitral. Good job. And now that we're flat, I'm also taking a moment to look at the abdomen. It is flat and non-distended. It has no masses, and the skin is good. It's warm, good colored, hot to the touch, warm to the touch. I'm going to also take the aorta, the right and left renal arteries, the iliac arteries, and the femoral arteries with my bill for bruits. Okay. And now I'm going to auscultate the the belly sounds, starting in the right lower quadrant, moving in the clockwise position. Good. And I was listening for 5 whole minutes because that is the accurate way to assess for bowel sounds, and they were normoactive. I'm now going to percuss. Timpani was heard throughout and dullness over organs. And now I'm going to palpate with light sensation and deep sensation in the right lower, right upper, left lower. I'm now going to palpate for the spleen and the liver, which neither are palpable, so that is good. And let's go ahead and sit you up. So now we are going to be looking at the range of motion, strength, all that good stuff of the upper extremities, and also keeping skin in mind. So I am going to be looking and palpating the joints of the hands, elbows, and the shoulder. I am going to check the radial pulses, which are +2, capillary refill, less than 3, and now I'm going to have you follow my motion, Zach. So hands out like this with your fingers only. We're going to do flexion, extension, hyperextension, abduction, adduction, thumb opposition. Now with the wrist, we're going to do flexion, extension, hyperextension, rotation, and then we're going to do radial deviation and ulnar deviation. Good job. With the elbows, we're going to do flexion, extension, hyperextension. And now with the shoulders, we're going to do flexion, extension, hyperextension, internal rotation, external rotation, adduction, abduction, and circumduction. Good job. Now we're going to test the strength, so squeeze my hands as hard as you can. +5 or 5 out of 5 bilaterally hand strength. Make a muscle. I'm checking the strength of the biceps and triceps. Pull against me, push against me. 5 out of 5. Now I'm checking the shoulder girdle strength. So I'm going to have you push up against my arms, pull down. Good. I'm also going to assess cranial nerve number 11, which is the spinal accessory nerve. I have a patient shrug against resistance. Good. I'm now going to do a series of cerebellar coordination, rapid alternating movements. So we'll do serial finger opposition, and then we will do hand flip flop on your thighs. And now I'll have you take your right hand, touch your nose, touch my finger, touch your nose, touch my finger, touch your nose, touch my finger. Other hand, touch your nose, finger, nose, finger, nose, finger. Good job. Now I'm going to check for vibratory sensation over the proximal ulnar prominence and the medial malleolus. So close your eyes and tell me where I'm touching you.
Wrist.
Yep, and again.
Ankle.
Yep. And I am now going to test for sensation. We're going to pretend like he does not have pants and long sleeves on. I'm going to use my little cotton ball, so close your eyes and tell me where I'm touching you.
Right arm. Left arm. Left leg. Right leg.
Great job. I'm now going to move on to the feet, and I'm going to be palpating and inspecting the joints of the toes, ankles, knees, and hips. I'm also going to be checking for crepitus, redness, deformity, swelling, symmetry, tenderness, and nodules. So I'm going to check the dorsalis pedis, +2, posterior tibial, +2, capillary refill, less than 3. And we are going to do a range of motion test. We are going to have you do, have your toes follow my movements. You can see it. We're going to do flexion, extension, hyperextension, abduction, which my husband told me he cannot do, adduction, and then we're going to do wrist. We're going to do dorsiflexion, plantar flexion, dorsiflexion, rotation, and we're going to do inversion and eversion. And then for the knees, we're going to do flexion, extension, hyperextension. A good job. And so I'm going to test your strength of your feet. So push like a gas pedal, and then pull up, 5 out of 5. And now push against my hands, and now pull against my hands. Good. Knee strength is a 5 out of 5. And your hands are right there, and I'm going to do a test for stereognosis to see if the patient can identify what is being placed in their hands. So close your eyes. What is in your hand?
Coin.
All right, other hand.
Coin.
And graphesthesia, keep your hands out, tell me what I write.
A.
Good job. And so now I'm going to have you stand up.
Turn my shoes.
Yes, you can. I would have them in non-slip socks if this was real life. I am going, sit back down one more time, I'm so sorry. And now I'm going to test the strength of the hips. So squeeze and spread. Yep, 5 out of 5. Now I'm going to have you stand up. We are going to do hip range of motion, scooching. We're going to do flexion, extension, hyperextension, flexion, extension, hyperextension. We're gonna do adduction, abduction, and circumduction. And you're gonna do abduction, and then adduct. No, that's adduction because you add it to the body. Abduction, you abduct it from the body, and circumduction. Thank you. Now we're gonna do external rotation, internal rotation, internal rotation. That was terrible. Okay, turn around. We're now going to look at the spine. I'm looking to make sure that his midline is symmetrical. I'm going to have the patient flex their cervical spine, so look down for me. I'm checking the scapula to make sure that they're equal, which they are, no signs of scoliosis, and there are expected curvatures. I'm going to be turned back around. We're going to do lumbar spine range of motion. Flexion, extension, hyperextension, and then lateral flexion, and rotation. And then we'll do the same thing with our neck. So flexion, extension, hyperextension, lateral flexion, rotation. Good. We'll do a Romberg test. So I'm going to have you close your eyes and hold out your arms. No swaying noted, good. So relax. And now I'm going to have you take a couple steps towards the camera and walk back to me, heel to toe. And this is me assessing the patient's gait, which is steady. And now I'm going to have you hop on one foot, hop on the other. And now I'm going to have you sit back down for a second because I just love finishing off my test with reflexes. Right, Zach? So we're going to do the brachioradialis. We'll do the bicep. Okay, and brachioradialis. Bicep. And now tricep. Just relax. And this one. And we'll do patellar. Did you do this? I couldn't remember. And then Achilles. And Babinski. You really didn't have that much of a reflex in that? I feel like you didn't. Alrighty, well, that should conclude my test. And thank you for watching so long.